Hi, my name is Cynthia Kahele, and I'm the children's therapist over at the Women's Center of Beaver County. I work with children and families that have either experienced or been exposed to domestic violence, child physical assault, or sexual assault. Now, this is important not just to help children be able to process their trauma and heal, but also for the fact that medical studies and science has shown that the effects of trauma are not just immediate, but they are also long-term and can transcend generations. So it's about the health and well-being of the child, currently as well as down the line. So working with children, there are different types of therapies that we utilize, and they depend on the age of the child, their development, as well as the child's needs. And we will do a thorough assessment on the child so that we're able to meet their needs where they're at. Now, some of the therapy is with very young children. We use different forms of play and artwork, which allows a child to tell their story, but without having to use vocabulary that they may not have. Another type of therapy that we use is called trauma-focused cognitive behavioral therapy. It's TFCBT for short. Now, it's a combination of a talk therapy as well as a desensitization therapy, because victims can hold things very close to them or try and suppress them. And what research shows is that doesn't work. Their trauma will find a way to manifest itself either physically, or they will experience emotional symptoms in other ways. So this allows their story to be told, but in a way that is safe and comfortable for them. Another therapy that I use with children involves the parents or caregivers as well. This is called parent-child interactive therapy, and it's Pcit for short. And this is a therapy that affects or can have a positive impact on the entire family. So even though I may be working with one child and their caregiver or parent in particular, it will also help other children in the family to regulate behaviors. So parent-child interactive therapy, or PCIT, is actually a two-phase type of therapy. And it was developed for children that had behavioral issues through ADHD or ODD. Now, what we have found is that the symptoms of trauma mimic the symptoms of ADHD and ODD. So there are children that have been misdiagnosed with having these issues, but actually it's just because they have not had a way to process their trauma. And so families come to me and there are these behavioral issues with their children. And after, doing an assessment and seeing if I need to do some individual work with the child, then I may deem that this is something that would benefit the family. So as I said, with PCIT therapy, there is two phases, phase 1 and phase 2. Now, phase 1 is based on attachment. It is helping the child and the parent or caregiver to bond. And that is very important because with children that have experienced some type of trauma, they can be acting out in different ways. And so what happens is they're drawing a lot of negative attention to themselves. And so a lot of chaos and criticism can reign in the household. So this is a way for the family to move away from that and to get into a more warm and stable environment for the child. And, like I said, it will also impact the behavior of other children in the home. And so it's just in general a very wonderful thing. Now, the phase 2 part of PCIT involves introducing boundaries and rules to the child and having them follow through without arguments or meltdowns. And this is used through timeouts. A lot of parents are familiar with timeout. Unfortunately, they don't administer timeout properly. And so this is a way to train the parent so that they can in turn train the child. And the result is a more warm and stable home environment. So as a children's therapist at the Women's Center, I am more than happy to work with school systems. I consider us all a team that are working to achieve the best for a child. So I am happy to talk to teachers, guidance counselors, as long as I have the consent of the parent and if the child's old enough as the child. So once again, my name is Cynthia Kahele. And if you have any questions, please feel free to reach out to me at the Women's Center of Beaver County. And I look forward to having you as part of our team. Thank you very much.
Hi, my name is Margot Myers, and I'm the Therapy and Counseling Program Supervisor at the Women's Center of Beaver County. We offer an array of services, many of which you are already aware of. However, I'm going to speak specifically about our therapy and counseling program. So our program works with any person in the community or that is residing in our shelter program. It is not restrictive to age, so we can work with anyone from childhood to adulthood. And our focus of work is around those who've experienced sexual assault, either in adulthood or in childhood, as well as those who may have experienced domestic violence. So we have a child therapist, Cindy Kahele, who is also sharing some information specific about the child program. And we also have adult therapists who are either licensed or license eligible and working towards their licensure. All of those individuals are trained in trauma-informed counseling and therapy practices. That includes things like Pcit, or parent-child interaction therapy, for working with children and their parents. Trauma-focused cognitive behavioral therapy, which is a specific CBT program that works with children that have experienced some trauma. And we also have, most of our clinicians are trained in eye movement desensitization and reprocessing, known as EMDR. So all of these programs are evidence-based, showing that they have significant research to show that they do help to minimize the distress and the impact trauma has had in people's lives. With that said, we work with clients of all ages, children, teens, and adults. We work with clients from anywhere within the Beaver County, as well as clients outside of Beaver County in the counseling program. And we also focus on working with the clients based on what they hope to achieve through counseling and therapy. If there are things that you are questioning about your experiences as a child or as an adult, or you know people in your life or in the school settings that have experienced some sort of trauma, please don't hesitate to contact the Women's Center of Beaver County to see if they are eligible for our counseling services. Again, we offer a lot of different types of counseling, and it's really focused on what's best for that person. We individualize the programs to make sure that any person that receives our services, no matter their gender, their orientation, their age, feels safe and welcome in our program.